And that's why I want people to study reputable material. If you're studying something that is not there, it's not affecting you as a nurse. And that journey of you learning, getting educated is going to lead to better patient outcomes. And that is, I do. I don't go to a provider that's not a board certified provider. I want my nurse board certified. I want to know they took that extra time. I think families like seeing that on your badge. They like asking, what is this? And I'm proud to say I'm a certified emergency nurse. I'm not going to go through the whole alphabet with them, but I'll, make sure they understand I took the extra time to study this to make sure that
Yep.
I stay up to date. It is the absolute best thing that I can do. And it makes a huge difference too. It should make a difference. And people are smarter that we're now looking in healthcare as a business. They're going to ask those questions.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement because we all know emergency nurses have the best stories. Now, here's your host, Kevin McFarland.
Hey everybody, Kevin McFarland here from the Art of Emergency Nursing, and thanks as always for downloading this episode and listening to the podcast. If you're not aware, March 19th is Certified Nurses Day, and this is the day that this episode's coming out. You probably already know that I'm a big fan of certification. I think it's important to be certified in your specialty and highly encourage all nurses to do that. Now, I'll be the first to tell you that experience is one of the things that you're going to need to pass that exam, but that's not all you need. For these certification exams, these certifications exams go deep into the material, and for any specialty exam, you got to really dig in and study the material to be ready for the exam, regardless of how many years you have as a nurse. Luckily for us as emergency nurses, there's a ton of really great study material that's going to fit the way you study. So there's a lot of options out there. If you have any questions on that, just reach out and I can give you some recommendations. But if you've done any research on the BCN material, that's the CEN, TCRN, CPEN, flight and transport nurse, and now the burn nurse certification. But if you've done any research, chances are you've come across the name of my next guest. My guest on the podcast this week is Pam Bartley. Pam has become pretty well known in the certification review space. Not only does she teach live reviews, but she has a study guide that's one of the things I use to help when I had to retake my CEN exam. In this episode, we talked a little bit about Pam's journey to becoming a nurse and becoming a nurse educator. And then we get in and spend a little time talking about getting ready for those certification exams. You'll hear me mention a previous episode that we recorded together. I'll leave a link in the show notes so that you can check out that episode as well. Well, let's jump in because you're going to really dig this episode with my friend, Pam Bartley.
I feel like I'm the old school nurse. This year, 2024, will actually be my 40th year as being a nurse. I graduated in 1984 with an associate's degree in nursing, back when it was another mad rush of how to get nurses out in the working field. So associate degree nurses they were kind of backing off on diploma at the time and kind of going more associates. And then before it kind of pushed to bachelor. So I've been working since I was 19 in a medical floor, surgical ICU, emergency departments, education. I've done legal consulting. I've worked for multiple medical equipment companies, but really education is my passion. That's the one that I want to make an impact. I think that's the thing I'll leave the bigger impact on, more so than taking care of patients at the bedside are wonderful. But if I can impact and watch those baby nurses grow up, I love it. Love it.
It kind of multiplies your impact, doesn't it? When
Yeah.
you're teaching, you can take care of so many patients, but if you're teaching the groups that are then doing it, it just multiplies your impact. It's just one of the things I've always loved about teaching too.
And you watch the light bulbs in their eyes, and you see them looking at each other going, we're supposed to be doing it that way. And that, is going to save someone. It's going to make a difference. That's the real light that really keeps me going.
Absolutely. Absolutely. It's amazing how that, to me, that's one of the most important things about nursing is teaching and sharing your knowledge. And which is one of the reasons why I do this podcast is just to share the knowledge of these amazing nurses that have come before me that they may not get the lessons otherwise.
Yeah. And then the providers, I still work and help with education in the rural local hospital where I live. I walked back in there the other day and it's just, it's home. And it's great to know when you get sick, when your child is sick, when any of your loved ones is sick, that you've got somewhere you can take them. And these are people that you trust. And this is, and you trained them and they know how to do things. So it definitely, it comes full circle. And my daughter's a nurse. I wouldn't have sent her to nursing school if I hadn't felt like this was a career. It is a career. It is a passion, and she's doing her passion, which is being a wound care nurse. So she
Oh, very
likes the
cool.
decorating. I had her in the ER stuff while she was in nursing school, and she learned enough about the emergency room to know she didn't want to do that. She
Oh,
likes chronic. She likes to follow through with the patients. She likes to see what's going on with them. So a much needed job.
absolutely. God bless her for doing it. Because, one of the things I always think is, all the different things that you can possibly do in nursing. That's one of the things I really like about nursing is, like, if you get tired of being an ER nurse, go do ICU for a little while. You get tired of ICU, go work at the clinic, go do, whatever, go find a non-clinical job. There's plenty of those out there
Yep.
that you
Go
can
on a
do.
mission trip and
Maybe.
humble yourself. And then when you come back, you have a whole different perspective. I don't know that you need to spend your entire career in just one area. I really think the more diversified you are, I really think it decreases that burnout. I really think you need those breaks, but you need some things that humble you also. Emergency nurses go work hospice for a while. See the other spectrum and see why we don't resuscitate people that and in no way ever wanted to be resuscitated, and just
Oh,
understand the ethics and the humanity of that.
you're absolutely right. I think it's an important lesson that not I think there's some people that are like, this is all I'm ever gonna do. This is the kind of nursing I'm gonna do. And then there's other people that try different things and then I think enrich the emergency nursing experience because they bring other experience forward. Like I think that when I became an ER nurse, I always worked ER. Yeah, I never went and worked the floors before I became a nurse or before I became an ER nurse. And I, you know, I always tell people I kind of regret that. Like I kind of regret that I didn't go get some time in med surg, go get some time in SAC or subacute or tele or whatever. Because what I found is those nurses that did do that, like they knew stuff I didn't know.
Yeah, and their time management. I worked on a medical floor on night shift, 36 patients. There was me and an LPN, so we had 18 patients apiece, but I was still in charge of all 36. You talk about learning time management, you learn time management, and you learn how to work. You only have that one other person. I mean, you learn how to work as a team, and you learn how to
Yep.
prioritize. Because some of those patients, honestly, on some nights, you didn't see them. You had to prioritize your care for those patients.
Yeah. And what made you decide to get into nursing in general?
I did it as a child. I come from a very traditional family. I had an older brother who's 6 years older than me. My father told us straight from the beginning, he'll go to med school, you'll go to nursing school. It was just kind of a traditional family. I also had some renal kind of things when I was younger, spent a lot of time in hospitals. Always stressed my parents out because it always seemed like the holidays is when something would happen. So I spent many holidays in a hospital, and you bond with nurses, and you just see that as your role. And they let me dress. They taught me using stethoscope, doing blood pressures. I was taking care of patients on the pediatric ward at Christmas. I was just making rounds with the nurses, doing, carrying a urinary catheter bag. It was just any kind of thing with that. So the IVs didn't bother me. None of the stuff bothered me. So it was always, and I've got quite the amazing family that had medical kind of things. So I've kind of lived through it. So it was that really just a progression of what I knew I would always be.
How cool is that? So never any doubt that you didn't make the right choice.
Wow. And I had never had a job before I started, age 19 in that hospital as a registered nurse or as a
Wow.
graduate nurse because we took NCLEX later. So you were a graduate nurse for 3 months. Never done another job before. And the first night, I think my preceptor called in. I was in charge on that medical floor, 36 patients. When
Oh
you
yeah.
the realization that 36 people's lives are in your
Depend on you. Oh
and
my gosh.
you realize that LPN, who they now told you that you were in charge of, is going to teach you everything that you need to know. That's the person. So for anyone who's ever the nursing assistants, the LPNs, the telemetry techs, because we had a PCE part of that also in telemetry, they taught me everything, everything. But it was a little scary, and I will say my time organization was not good enough to do 36 patients. When there was an opening in the surgical intensive care unit, I jumped, I ran. I'd been a nurse for 3 months. I just finished and had my RN, and they took a chance on still. I think I turned 20 at that point. Took a chance on letting a 20-year-old come work in a surgical ICU. So it was those leaders that took that chance on me that really made the difference.
I feel so old when I say this, but I can't imagine a 19-year-old taking care of patients. Like
Oh,
it to me, like I was so irresponsible at 19. Like I wouldn't, I couldn't be trusted with an animal, let alone a person. Jeez Louise.
it is awesome and it's humbling to think about the things that I did at that age, but it also really impacted me. I didn't understand the surgeries. I wasn't taught any of that in nursing school. All of a sudden, I'm in the surgical ICU and they're talking pericardial windows, and I'm like, how do you
Yeah.
imagine this? And they could just see the look in my eye, and it was like, what's the next day you're off? You could just come to surgery. And that's what I really learned was just going to the OR and actually letting them teach me and seeing the physiology. I work in a small hospital now that has a lot of forensic pathologists since we get a lot of the contracts for the state. And when you work with them doing the pathology and watching autopsies, that's when you understand physiology. But you've got to put the time in. I did this on my days off. So when you
Uh,
mention that, now they're like, "Oh, we're tired. We're not gonna go do something on a day off."
yeah.
Or
No, there's none
get
of
it
that.
due to some of those things. Those opportunities just don't exist now. Then they were happy to have help.
Yeah. I remember many a times, just going in extra and just doing stuff just to learn. Like you're like, it's just what you
Absolutely.
did.
Yeah, the
Just what you
first
did.
organ donation, first time that there was an organ donation, I was like, I'm off work, but I wanna go to the OR. I wanna understand, and I wanna be with that family. I wanna see this process through. I wanna and that's still some of the things with emergency nursing that's, it's the ICU nurses, I think, that kind of pull at your heartstrings, except for some of the, some of the ones in the emergency department that are just not treated fairly, it's the judgmental kind of
Yeah.
stuff, there that still grab our hearts for those. But yeah, learn every opportunity, whether it is listening, sitting in a class, even with the medical equipment training that I've done. So many nurses are like, I don't have time for this education. Yeah, I know that monitor. I've worked with the monitor. Have you worked with this monitor with the newer capabilities? Sure. And the only question they'll ask is, how do you silence the alarms? And that's it. And they sign the paper and they walk back out of the room. And the next patient who comes in, my husband has a resting heart rate of 48. Well, they're going to turn the alarms off as soon as he gets there. So he's really not going to be monitored the entire
Yep.
time nobody's really going to watch this. And it's just making sure that we really try to get in. So, if they can just listen, those trainings are succinct down to probably you do them. You on 5 minutes. That's all we want is to teach
Yeah.
you how to learn alarms. Makes a
It
difference.
it drives me crazy when I see nurses that just don't seem like they're willing to learn. They just don't they're like they feel like they've already got it all figured out. And I just think to myself, these are the most dangerous nurses on the floor
Yeah.
because
I'm tired.
they don't know what they don't know.
Right. And they all tell me I'm too tired. I've got to go home. I'm too tired. But they're the same nurses who pick up that overtime over and over and over again. I always tell them that overtime, that money is not gonna do it for you. You're gonna burn out and you're gonna be gone. You're not gonna be here. Work your 36 hours and leave it alone. Quit with this overtime. Take your time
Amen.
off. Don't the money is not gonna make a difference, but you burned out, and not taking the time to make the changes that need to change in nursing practice, getting involved with your associations, whether it is the ANA, the ENA, AACN, be the change agent. Don't sit and complain about it. Change it.
Amen. Amen. I got to tell you, one of the things that when nurses tell me they're burned out, one of the first questions I always ask is, how many hours a week do you work?
Yep.
And the answer is always more than 36. Like,
Always.
and I'm just as guilty as everyone else. I work, an overtime shift day of the week, just by my schedule. But, for instance, last week, my counterpart, his wife was in the hospital, so he was out. So I ended up doing 5 days last week, 12-hour shifts last week, and I was tired. So
Yeah.
then when my boss called me on Friday and she goes, "Hey, if you want to take Sunday off, I can get you covered on Sunday." She goes, "I know I haven't been able to cover these days, but I can cover Sunday." And I'm like, "Done,
That's
take it." I
that's
was like,
what
I'll take the day off. And man, it was kind of nice because I worked, Friday. I spent the day sleeping because I worked all night Thursday, and so I'd like it really my only day off is Saturday.
yes.
So man, it was great to be able to have a Sunday and sit at home and spend the day with my wife. Yeah, get up. I
Every
gotta go to work tonight, but I'm well rested and ready to go back. So
Yeah, and mentally, you're more clear. And that's, the mistakes that we make, the challenges, the maybe losing your cool a little bit comes when you're just mentally and physically exhausted. So,
absolutely right, absolutely right, absolutely right. I think it's unfortunate that and I get it. It's one of the nice things about nursing is you'll never want for hours or for availability for work.
yes,
Like there's never going to be a shortage of work, but unfortunately there's never going to be a shortage of work.
right.
Or anyways, tell me about a patient that changed the way you practice. Tell me about a patient that shaped your practice in some way.
In the emergency department, it's been the alcohol dependent patient, the drug dependent patient, and it's the survivors of assault. It's the interpersonal violence. It's the sexual assault. It's those when you hear someone say alleged, they allegedly were assaulted, and that just is a buzzword that it just drives me crazy. Or the addict, and that's just nothing more important than using a person first language. Like, you don't know when it's going to happen to you. Over 40 years, I can tell you the number of coworkers that I've worked with that are alcohol dependent, that are prescription drug dependent, and sometimes not non-prescription drug dependent. It it starts with a back injury, and here it goes. And if it hasn't impacted your life, you're lucky. It's going to impact everybody's life. So the judgment stuff that I hear from that, and just trying to realize and take a step back and try to make sure that we're offering the same fair care. My addiction is Krispy Kreme donuts. I live in the South. But I would treat someone who is oxycodone dependent the same as I'm going to treat myself with my own Krispy Kreme dependency. If I come in and I happen to go by the Krispy Kreme with the hot nail sign on, and I come in and my blood sugar is, uh, you know, 1200, nobody's going to slam insulin at me and say, I'm going to teach you a lesson for eating those Krispy Kreme. What,
Yeah.
what difference is it? They're not going to take the cardiac patient and go, let me slam some nitro in you to teach you a lesson that you shouldn't have eaten that fatty meal or done cocaine prior to coming in. Nobody's going to do
Yeah.
something to teach you a lesson. I think those are the ones. My other ones that have taught me and humbled me over the years have been my family. That's the long term care. It's stimulating. Our daughter was born at 32 weeks gestation, and that was 34 years ago. So when you're looking at a 2 pound something baby 34 years ago, and that knowing that you now have to come home in the first year of this child's life, you are going to be fighting to get that weight on them. Uh, my father-in-law had dementia and died in 2022. So those last 2 years during COVID were horrific. He already was losing who was who. And then to not to be able to visit as often, to have to wear a mask and him not identifying people because of a mask. Um, it- we, it's just such a horrible time for those patients. I don't think we'll ever admit how many things went wrong during that pandemic of 2 to 3 years of the increase in interpersonal violence because people were left at home with ones they've never been there with their spouse that many hours, their children, their adults, their parents who they had never had to care for, but they had to help with, or that they were just totally isolated. It's watching him with dementia is just, it was horrible. And I think that's one of the biggest things about the pandemic that will always bother me is that we didn't have the family side. We mistreated and we misdiagnosed so many patients, focusing on one disease process and not seeing the other. So those have always been the most humbling things for me.
It's hard to believe. And I seen some Facebook memories that showed up that, talked about how, about 4 years ago, right around this time was the hot start of COVID when really the world changed and the world changed for everybody. And it's crazy to think that we're, 4 years post and still not done, of course. But, it's something that's, going to always be around. But man, the world was different there for a little while, wasn't it?
Wasn't it? And if nurses didn't stay heroes and if the salaries didn't stay up after being the heroes that nurses and other healthcare providers were at that point, it's very sad that nobody still perceives healthcare the way it truly is and who's really working versus the CEOs and their, billion-dollar salaries. And the ones working really went back to the baseline after those times of pandemic. So it was very, very sad time too.
Well, I don't know how many nurses went and did traveling, and they were out doing traveling because the money and the opportunities were absolutely there's so many of them out there. And one of the things I remember saying to them is like, get it while the getting's good, because it's not gonna stay this way.
Yep, nothing.
And
If you can make the money, yeah.
yeah, yeah, get it
But
while the
making it
getting's good. But
least
there were so many people that did, and like I remember, like our staffing at the hospital getting just gutted.
yeah,
And the hospital that I worked for at the time, eventually, it took a while. They had to lose quite a few people before they're finally like, "Hey, we're going to give you guys the stipend that we would be paying the travelers, and we're going to give you guys a stipend and say, hey, we're gonna bump your pay for this crisis pay." And they did that for, gosh, I don't know, months and months. They did that for
it amazed me
because they were losing so many people.
how long did it take the CEOs of the hospitals to figure that out? How long did it take the boards? How long did it take them to figure this out? I can either bring in this person or pay the person that I have now. And it was just it just floored me. The whole process. I think it just was such a crazy time and just watching what was happening and all around the world, but especially here, and just watching what happened.
Yeah, yeah, it kind of looked crazy there for a little while.
Yeah.
So, and and I still don't think things are back to normal. I guess things are back to normal, but it's different. Like the world has changed.
Yeah. It has. It has.
But I think what it more than anything kind of made me realize is just how fragile the world is. You know?
It just takes one thing and that can change and really make make a huge difference all over the world. And just one little
Yeah,
thing affects us.
yeah, for sure, for sure. Now, one of the things I want to talk to you a little bit about is let's spend a little bit of time talking to you about certification reviews, because that's something you're kind of known for. You're kind
Uh,
of known for teaching certification reviews all over the place, and for helping people get through the certification reviews. So, what made you start teaching like the CEN review, the TCRN reviews, all the different review courses that you teach?
Well, if anybody's been in any of my classes, they've already heard this spiel. So, but when I was in that surgical intensive care unit, AACN's always had a specific number of hours you had to have to take the CCRN exam or any of their exams. And the educator just came to me one day and said, "Oh, your hours are in. Here's the huge 1,200 page core curriculum. Study this. We signed you up next week." And this was back with paper and pencil. They came, you went here, you had to sit there and do this. I do not learn by studying a 1,000 page book. I tried, and I had over probably about a year and a half experience. I don't think I quite had 2 years, but a year and a half. I took it. I'm still surprised I only failed by 1 point. It killed me. It really did. And the other nurses who would say, because this was big in ICU, and the nurse was like, "What do you mean you failed it? How'd you fail it?" And it took that away from me. I thought I was a jam up ICU nurse at that time, and it really took it out of me. So I went back to the surgeons. "How do you guys remember all the stuff that you have to remember for your boards?" And they were like, "Oh, dirty mnemonics." And I'm like, why didn't I think of that? I was in nursing school when they taught you on Old Olympus Towering Top. Who had been on Old Olympus Towering Top? Nothing made sense to me. So I sat down and created all these little fun things and went back, aced the CCRN exam the next year, and then just got burned out in ICU. We had several young patients. We had a postpartum patient that went into DIC, another younger patient that went into DIC, and at that time in the 80s, it was significant. When I transferred to ER, here was little Miss ICU coming to the ER, and the first thing I asked was, "When are we going to take the CEN exam?" And they all looked at me. There was no one. This is our busiest ER in the state. They looked at me like, "Oh no, that's just you ICU nurses that like to do this. We don't do this." So then it was a challenge. It wasn't, and I went to the ER, never been in the ER in my life, not as a patient, maybe a family member, but I didn't really interact with what happened in the ER. I thought the sick patients we had in ICU were the ones in the ER. And I learned that none of my surgical ICU patients came through the ER. They came from surgery.
Yeah.
So it was, and I had to make it fun to get these nurses to buy into it. I knew I had to make it fun. So I did. I created little mnemonics and little tips. This was the time that you could even put little quick tips in the bathroom, before the days of all the prevention and infection prevention and stuff. But I would just make up little mnemonics and stick them everywhere. And then we got everybody involved. And actually, I think I joined ENA probably 1990. Probably, yeah, something in that. And I think I got involved with the ENA, worked with a couple of others that were in ENA, including Mark Boswell. Mark was in South Carolina at the time, and we put together CEN review, and we taught this through the ENA, probably starting in 1991. And then it was the thing for the ICU nurses wanted me to do more critical care. And then it was teaching the ER nurses that they were critical care nurses and that they could take CCRN. And if you understand the physiology, you can take any of these exams. So it's been forever. And just knowing that certifications like CEN with a 52% pass rate that was up last year to 52, had been 50, and no one that knows nurses, if they study the right information, can pass that test. And just making that difference in them, but making it fun.
It's kind of crazy. And I think we've done a podcast before where we talked more about the CEN, and I'll link that in this podcast. But we talked about one of the things we talked about in that episode is we talked about how low the pass rate is for CEN. That kind of surprises me, but it's one of those that I think part of that is kind of the nature of who ER nurses are, where we're like, "Well, just wing it. We'll be fine. I've been an ER nurse for a long time. I'll be okay." And the reality is no, you got to study for those tests.
And some, again, just know that they remember NCLEX, how they studied for NCLEX. So they had the 1,000 index cards. You're ever making 1,000 flashcards. This is not NCLEX. We're not in pharmacology anymore. We just need to know beta blockers, ACE inhibitors. We need to know pros and cons. sedatives, paralytics, ACLS, PALS drugs. We do not need 1,000 pharmacology flashcards. And then they get dinged in on the material that's easy accessible, that is nothing but some NCLEX questions that someone puts a thing on there and says, oh yeah, now this is CEN review, this is a CCRN review, and it's just nothing but their same NCLEX questions, and they're just not studying reputable information. They all laugh and they'll say, your name's really big on your books. Yeah, I want you to know it's me. I don't want you buying the hack jobs. Okay, so most of us who've been teaching this for a long time have worked through this, know this material, and we keep the stuff's about the same price. And you can always see our rating is going to be 4.8. The one they'll keep exactly half price. So if ours is 50, it's going to be 25 today, and it'll have a 3 rating. But they see that half price and they go for it. And they really think, and those are the books that will tell them they need to shock asystole. That's question number 1. That should tell you you're in the wrong, studying the wrong stuff.
Yeah. There's a book that I've looked at a couple books on Amazon recently, and I was like looking at a couple of the books, and I was like going, one was for the TCRN, and I'm like, this is not a TCRN review book. Like, I don't know what this is, but this is not a TCRN review book. And again, I was looking at it going like, yeah, how could you possibly sell this as a TCRN book when this is really like a bunch of little trauma factoids that some of them might be good, but some of them, but it's not a focused review on anything that's going to get you through a test.
I think an engineer wrote that one. It's something about, I think I looked at that same one that you were talking about because I just crack up laughing. It was all of these laws of trauma. It was stuff that, yeah, it was more if you needed to know if you were working in the car industry and how you would make a car safer. That would be the factoids that you would need to know about trauma. And it leads them down such a bad path. And if there's anything else, always amazes me because I always ask them, if you're buying anything else on Amazon, don't you look at the reviews? If you just read one review on those books, it's going to tell you this was crap. This didn't help me at all. Just compare. There's nothing else that you would do. And if you were buying something, electrical lighting fixture for your house, and one was 50 and one was 25, you could just look at the reviews and you would know that which is going to be safer for you, which is going to be better. You're going to spend between $195 and $360 to take this exam, and you can't spend the right amount just to get you prepared. It just does not quite make sense. But I think a lot are really looking at the right information and understanding. There's still the struggle between understanding what the Emergency Nursing Association is, what the Board of Certified Emergency Nursing is, and kind of separating those two, knowing how to find the others' information. The websites are not as linked together, so it's a little bit more difficult for people. They're just trying to get the
Yeah.
information out there.
Yep. Yeah, absolutely. I think there's, certainly. Now there's people there's those that are, maybe struggle getting their very first certification. Then there's people who are like collecting them all, right? Like
Yeah,
there's
we're in the
a high,
sexy pack,
huh?
the sexy 6-pack of BCN. That'll
Sexy
be
six pack. I
yeah.
haven't heard that. That's hilarious. I haven't heard that one. So that's now there's 6 certifications, and there's a lot of people who like immediately rushed out to get all 6. And I don't know that I'm never going to have all 6. And though, there's been times I've been tempted, and I sit there and think to myself, well, I could pass that test. But
Yeah.
then I'm like, but it's not a certification I use or need or really, it's not what I do. But those initials do look pretty cool after your name. Like
Yeah.
that alphabet soup after your name looks kind of cool.
Yeah. But I only did the flight and the transport to help the nurses who were doing those. And again, with it being a requirement now, they have to have it. They just needed some guidance in a concise manner. They have a lot of
Absolutely.
training available, but it was intense, in-depth training, the 40 hours plus kind of training courses. So when I just did it just to make sure I knew what I was doing, bought all the reference materials and just made something concise for them. I wouldn't have done it if it wasn't making it something concise for them. So again, if
Yeah.
you like concise, mine's 4.9 rated, it is just what you need to know. If you need a comprehensive, then yeah, 40-hour course is what you need to do. But if you have that experience, do you really want to do a 40-hour? You know, they just needed options.
Yeah, absolutely. Absolutely. One of the last questions I always ask, and I want to ask you, but I want to tweak it. But one of the questions I always ask someone is a question called three things, where it's three things to remember and three things to forget. Now, for you, I want to I want to angle yours a little bit towards certification. So if someone's studying for a certification, what are three things they should remember, and what are three things they just need to forget?
The most important thing when you're studying for any board certification exam is to go to the leader, go to the association, go to where you're going. So if you're taking CEN, which is still a huge number of our emergency nurses is where they start, go to the Board of Certified Emergency Nursing, go to the BCN website. You have got 12 little bullets that you can hit that are going to tell you everything you need to know about that exam. Everything. So it's going to tell you how many questions are there. Gosh, it's going to be 175 questions. 25 of them are going to be unscored, so 150 count. It's going to tell you I need to get 106 correct out of the 170. Out of the 175. It's going to tell you. And then on the frequently asked questions, it's going to answer everything else. The blueprint is there and people get lost in what they're studying. So if you can just remember, study what's on the blueprint. Don't study extra stuff. The other thing is to remember to study the areas that you don't like. My weakness and the reason I'll never make 100% is behavioral health. Mental health issues are not an emergency nursing personality. Behavioral health is polar opposites. And I can read every textbook with mental health, but I'm always going to miss those questions. The other is going to be professional issues, because even though it's just 14 questions, there are so many questions in the bank of questions, and you just don't know what's coming at you. And I think when you're taking the exam, you get so clinically focused because so much of it is clinical, and you get that professional issues question in there, EMTALA, which will just be a simple question, but you miss it just because you're kind of going. So focus on what they tell you is going to be on there. Nothing's going to be on there they didn't tell you. Read the stuff on the BCN website, study reputable material. That's all you really need to do. And don't overstudy.
I think a lot of people tend to overstudy.
Yeah.
So I know nurses have been saying they're going to take their CEN for the last 5 years,
Oh, yeah.
and they're
People,
like, oh, still studying, still studying.
yeah. I'll have people that purchase study material for me in 2019. And they're like, oh, yeah, I need another book. And all right, the blueprints changed. ACLS PALS, if it was 2019, we have a new version of TNCC, EMPC, ACLS PALS. There's nothing in 2019. Well, can you just give me the new one? No. You're supposed to get it, study a week per of the 12 sections and take the test. I'm not here to, for you to read the same material for 5 years is just not appropriate. Now you're studying outdated information.
Absolutely. Now, how long should someone study for the test?
I tell them it depends on, again, TCRN I think is a good one to start with, because TCRN is the smallest blueprint. You've got the 3-page blueprint and it's just about trauma. So you've got the 150 questions. You only need 104 of those correct. You've got 6 sections on the blueprint. So if you study a week or 2, max would be 12 weeks that you need to study for that exam. Now, I still strongly recommend they take TNCC, ATC, and TCAR before they go into studying for this. And then look at the things that are available to you. The American College of Surgeons, Optimal Care of the Injured Patient, absolute free download. But those last 2 sections are only 15 questions each. So that's 30 total that come from that material. With that 30 questions, you're going to need, out of that 150 scored, you need 104, you're going to need those 30. But still, the bulk of your time should be spent on studying thoracic, because that's 37 questions total. So just studying that. CPN the same way. You've got to take EMPC, and it needs to be the latest version. And for ones that go, I can't get in a course. There are virtual courses occurring, probably 20 today. There's never a reason you can't get into a course. But take in EMPC, take PALS, take neonatal resuscitation, learning that information, then you've got 10 sections to study on the blueprint. Triage, I can't even remember how many questions are on triage for the CPN exam, 20,
A
28,
bunch.
a
Yeah.
bunch. But why didn't you go to the ENA website, download the free ESI 5th edition version? Why wouldn't you read that to be prepared for those triage questions? It's free, it's there. You got to know where your resources are, and you'll get the triage questions right from that. But if you're not prepared for the triage questions, you're going to fail that exam. So
Absolutely.
a week or two per section is what I usually tell people, not 5 years. If you're still studying 5 years later, you could have a doctorate degree.
Right? It's a good
Why
point.
why are you doing this? This is a 3-hour exam. This is the point of doing certifications versus extending, and furthering your other education this is faster. This is not something,
Definitely faster.
yeah, it's not going to cost you $60,000 and you're not going to spend 5 years. This is 3 hours. So putting 10, 12 weeks in for something that's 3 hours is more than enough, more than enough. So I like concise, but the Emergency Nurses Association has a comprehensive CEN review. BCN next week for Certified Nurses Day, Emergency Nurses Day, or no, Certified Nurses Day. We'll be releasing their comprehensive CEN that's got like 20 something contact hours. So if
Oh,
you are looking for comprehensive, it's there and it's written by the ones who are in charge of the exams. Oh, yeah, it's you've got the option that is there. Depending on how you learn best, study it that way. But this is
yeah.
not going to be 75 questions. Lots of questions. They got to prepare for that.
Right? I remember when I was taking my NCLEX, everyone made such a big deal about if you get 75 questions, you either passed or you failed. And if you got 100 and what I forgot how many questions it is max. It's like a lot. I don't remember now. But I remember people saying if you get 75 questions, you're probably golden. If you got however many, like over 100, I forgot how many questions it like maxes out at. And I remember mine shut off at like 90. I was like, I don't know whether that's a good thing or a bad thing. And I don't, who knows? I was like, I guess I just got to wait and see. And talk about a comprehensive test,
Right.
everything in nursing.
Right.
So,
Yeah. But it's a different focus. And some of the things haven't changed. The ones who are taking this a little earlier when they've, been out of school a few months or a year, not that they can't, BCN they don't require, they suggest 2 years of experience. But the ones who are taking it earlier just think it's going to be like NCLEX. And I think that messes with their mind. It isn't going to be. I've had ones that sit in a review class and still at the end, are you sure it's not going to turn off at 75? Positive it is not going to turn off at 75. So prepare yourself for sitting in, for 2 hours, max 3 hours, whatever it's going to take you. So I think the things that you said about forgetting is forgetting the way you study for NCLEX and really focus on you're not studying for a 90% pass rate exam, you're studying for a 52% pass rate exam. And you're going to have to vary that up a little bit and just and staying away from the 1,000 flashcards. It's just going to drive you crazy, and then really focus on not overstudying. So forget the overstudying. You're not spending 4 years. This is going to be it's a different type of exam. So those would be my forget things.
absolutely. I think that's, I think that's amazing advice. I think it's great advice. So this has been a lot of fun. I'm glad we finally got a chance to do this and
And
do this again.
we're always so busy, always.
Right? Right? Been talking about this for a little while. So I'm glad we finally got a chance to do it. So
During COVID, I was zoomed out. I will absolutely
I
tell
bet.
you. I
I
was,
bet.
yeah. The virtual courses, I tried them. It wasn't for me. It was not my teaching style. I like to see people's faces. I like to see where we're going. I feed off of the audience. And
Absolutely.
virtual with someone laying in bed, and yeah, I was feeding off of that audience, and just was not where I felt that I was doing my best and that I could really do the best by people. Some people are just better at that, and it's not something I felt good with. And my pass rates were not the same. And I don't know an exact pass rate because not everybody gets back to me, but I know it's high. I don't want to mess with that. I don't want to have anything near a 52% pass rate. So, and virtually, I just wasn't sure I was reaching people. And so it's just a difference. But I was just done with Zoom.
Now it seems like, yeah, you were doing a lot of live classes and doing a lot of live teaching, and then when COVID hit, it seemed like you kind of pivot to saying, okay, well, if I'm not going to get out there and see you, and I don't want to necessarily do a virtual, it seems like that's kind of when you kind of really, I know, kind of leaned in on getting your hand out there.
Yeah, yeah, the study guides, they were already created, and it was looking at what else I could do besides trying to do virtual. And my husband retired in 2018. So I told him, you now work for PDB Nurse Education. This is now your job. So we bought copiers, printers, we bought all these. So I have a whole room in my house that are just have these huge copiers in there. So we bought copiers, bought who knows how much stuff there. And I was like, we're just going to print these. So I would just by social media. That's when you realize how many friends you have. Social media. I put it on there, started a basic website that said, yeah, if you want these, contact me. And we printed these off. And he went to the post office probably 3 times a day with
Wow.
10 or more of these packets. And we started with CEN and TCRN and CPEN. We were selling a lot of study material. I tried to do e-delivery for a while. It was the legal issues that came up with that because once somebody got a PDF, some people took advantage of that. And then that's where a lot of our hack study material, they didn't even understand what they were hacking it. They didn't even know what they were doing with it. But they took that and used that. So therefore had to hire 2 law firms, and that's hard to have to do, but when you've got an entire hospital just sending it through all of their staff, and that's just not right. So we
Yeah.
started printing, and then when COVID hit, it was the being able to mail the study guides. All the US Postal Service focused on was Amazon deliveries. And as
Yeah.
much as I thought I didn't want to be someone that sells their material on Amazon, I wanted to keep it mine. I felt like that was not correct, but I really didn't have a choice.
Yeah.
Well, we transitioned over to Amazon. It's nice now because I can track everything. It's great and it makes it a lot more simple. So it's been a good thing. And again, with us transitioning into this role of our life as being grandparents, this is something as a legacy. Unless I really totally and some days I want to totally back off and leave it alone, but other days I'm sitting here rewriting the CPN study guide and TCRN study guide. So
Yeah.
gives me something that's good. I will say my husband does not miss the post office.
I bet. I bet. So, so does Amazon do all the printing and shipping now for you?
Yes,
Oh,
they
that's
all love
nice.
it. Now, of course, they're taking half the money,
Of
but
course.
when you look at the number of people that you can reach internationally, so again, there's many that are sold a lot in Canada, a lot in Europe, and they're sold everywhere. So everybody has access. I also have just a supplement that's on Kindle. I don't want to put the entire thing on Kindle because it's a lot. It's a couple hundred pages, so it's kind of a lot for that. But just a supplement, so people can supplement their material. But that way, everybody has an opportunity that they can study the concise. And what I've been updating now is just adding more critical thinking because I don't want people to just feel like, oh, the key points are there for you to memorize. They're not there for you to memorize. They're there for you to work and make sure you understand why those are key points. So I'm switching it around a little bit based on feedback. The feedback I get is how I change things.
Good for you. Good for you. Do you have any idea how many study guides you've shipped over the years?
A lot. I was gonna look that up. It's funny that you asked that when you said that. I did when I started. It's easier to track on Amazon before.
I bet.
We were in such a hurry. It was just trying to track. It was crazy.
Even imagine.
Yeah, it was so many. Just what we paid in postage per year when I was, doing my taxes was thousands of dollars just on postage, tens of thousands on copy paper. It was just unbelievable. But when we started Amazon, I kind of set myself a goal of how many I would sell by this point, this point, this point, if this was going to be worth the months, really, it's months of sitting with, all the reference books that the item writers use. You sit there with each of those reference books and you cross-reference everything and you check it. And there's so many different things that are just misinterpreted from one to the other or written differently and trying to get the right phrasing and then submit the stuff to BCN and really go through that. Uh, but I set goals on that just to make sure it was gonna be worthwhile. So it's definitely, uh, they're out there. It's probably 100, over 100,000 for sure. I don't know exactly how many. So, if it's something someone's thinking about that has the knowledge and has the time to put it together. But people always say, "Oh, I wanna do this. I wanna do this." Do it. Just realize
Yeah.
it's take a lot of time to put it together.
It's having taught multiple certification review courses myself, I can tell you, and I can vouch for it is a lot of work. And it's always stuff you're updating. It's always stuff you're constantly going back to the well because things change. Things change. I
Thankfully.
was yeah, it's a good thing.
Yeah.
So I'm in the process of reviewing I teach the nursing professional development review. And
That's what
I've been teaching that with med ed for,
yeah.
gosh, probably 2 years now, and it's constantly, I'm getting ready to do another class in April, and it's, update it again, go through it all again, so
Evolves. It absolutely evolves, and you learn, and the feedback or just a little that you get from one audience kind of tells you, and every audience is different. You might have a plan of how you're going to do this, and you've got to kind of shift and make a change. It's a lot of work. And people, I get 5 emails a day on when are you going to do a prep book for the burn certification now for the certified burn review. And my other story of heartstrings is my husband getting burned when he was a lineman back in 1992. And we went through 10 years of surgeries. And that's
oh,
where people do not, and you understand again with Jenny, with organ transplant, you understand the years of and how your life evolves, how your life changes from that point is stand still and work with it. And, again, just the initial burn certification exam when they just did it out there as a testing kind of thing. And people thought, oh, they're just going to pass. This is focused as a burn expert. This is just not, oh, it's just American Burn Association formula fluid. No, the fluid in the first couple hours means nothing to this patient. That's not the important thing. It's really working with these families. Where's the skin going to come from for grafting, and how can the fluid is important because it's going to make sure that you have salvageable skin that is there. You're getting the circulation. But could I pass the test? Absolutely. I've lived it for 10 years. Do I really want to put myself back through that to write it? No, that just is not something that I really want to do. So it's looking at why you're doing it. And again, remember that most emergency nurses are not going to be burn certified nurses. They're a specialty for a reason.
it's yeah, I seen that come out. They were looking for people to take the
They,
beta, and I was like, not even a little bit interested in that, like. And I've taken the advanced burn life support class a million years ago. It's still around, but
yeah,
I took it a million years ago. And it was
definitely
a great course, but it's a hard course.
very hard. Yeah, but that's just again, that's kind of like taking TNCC before you take TCRN. That's a pre, but it's not going to give you everything that you need. You really need
Yeah.
some experience. Have you worked in a burn center? Have you worked with these patients? Do you really understand what that fluid is doing? That makes a huge difference. And understanding the grafting. The grafts are, you try so many different ones, and understanding that is going to be the years of stuff. So if you really don't understand grafts, you're going to have a hard time with doing those exams, and that's the
Yeah.
thing that people need to understand.
Yeah. Yeah. I think it's, for all the, for all the certifications you can have, it's one of those, like, all the certifications in the world, like, ultimately what it's meant to be is make you a better nurse
Absolutely, and
and
it's not the reason
make you a
they
better
have.
nurse. And yeah, like that's the reason to do it. The reason to do it is to help become a better nurse. And, we talked about this, last time when we said, kind of the journey is the win. And it's absolutely true. Like, studying for the certification review is what's going to make you a better nurse.
Yes, and that's why I want people to study reputable material. If you're studying something that is not there, it's not affecting you as a nurse. And that journey of you learning, getting educated is going to lead to better patient outcomes. And that is, I do. I don't go to a provider that's not a board certified provider. I want my nurse board certified. I want to know they took that extra time. I think families like seeing that on your badge. They like asking, what is this? And I'm proud to say I'm a certified emergency nurse. I'm not going to go through the whole alphabet with them, but I'll, make sure they understand I took the extra time to study this to make sure that
Yep.
I stay up to date. It is the absolute best thing that I can do. And it makes a huge difference too. It should make a difference. And people are smarter that, that we're now looking in healthcare as a business. They're going to ask those questions. So
I have a jacket that's got my credentials on it, and it's got, it doesn't have all of them because it gets a
right.
little long.
Yeah.
I'm certainly no Andrew Bowman, but I got a few credentials on there. And I always, anytime somebody asks, they're like, well, what does that mean? Why is it, not just RN? Like, well, yeah, it's RN too, but it's also all these other things as
Yeah.
well. So,
It's
and,
just
just talk about,
to be that smart, to be Andrew and to have the knowledge base that he has, we
right,
can we can always strive just to have that much. Just have that
right.
absolutely. And he takes these exams in like 30 minutes. So he's like that.
Yeah. Yeah. He goes in there just, yeah. And then one of the things I think he retakes the exams too. Like,
Oh
I
yeah,
don't think he turns in the CEs. He just
oh no,
redoes the exam.
it's faster. It's faster to retake the exam than it is to track your CEs. But when
No.
people talk about the contact hours, and oh my gosh, how would I ever get 100 contact hours? One national ENA conference. By the time you get the virtual stuff, I think
But
last year
50 hours,
52 hours. I think the year before was
something
maybe,
like that.
that's, that TNCC, EMPC, the things that we all need that we would all need to stay up on. That's going to be your 100 hours. So
Yeah.
it's unobtainable. And people just kind of freak out about that.
Yeah. Yeah. How-
Here we go.
Yeah. Yeah. You're like, that's not a review. That's not a certification review.
And it's easy on the website just to pull off what the references to item writers use. On the BCM website, you can see the exact references they're using. You can see who the item writers are, and you get a sense of just feeling comfortable with what you're studying versus, and it's just putting in the time. You got to put in the time to make sure. I always suggest people they attend the live or virtual course if possible.
Yep.
But I understand not everybody can do that. And the self study with a study buddy, a group is no matter what you're studying for. If you got someone that'll keep you accountable, is going to be key for that for success.
Yep. Absolutely right. So, Pam, this has been a lot of fun. I'm so glad we got a chance to do this again.
Thank you.
Thanks for taking the time to do this with me. I'll see you next month. Talk to you soon.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.